Morning, everyone. Thanks so much for joining us. I'm Sydney Wessel, Violence Prevention Administrator with ICJIA. I will be your host and moderator for today. Dr. Rachel Garth is here to provide an overview of the 2025 through 2029 Statewide Violence Prevention Plan. We also have a wonderful panel of guests here to discuss how to put it into practice. But first, I want to introduce Delreese Adams, Executive Director of the Illinois Criminal Justice Information Authority, who has some opening remarks.
Thank you so much, Sydney. Good morning, everyone. Thank you for joining us. We are here today to discuss a truly essential document for the health and safety of our state, the Illinois Criminal Justice Information Authority's 2025-2029 Statewide Violence Prevention Plan. This plan is more than just a blueprint. It represents a comprehensive public health approach to addressing violence. The plan recognizes violence is a symptom of systemic issues: poverty, a lack of community investment, and an over-reliance on incarceration. It serves as the strategic framework for hundreds of millions in annual grant making, aiming to create more resilient, safe, and thriving communities across Illinois. The success of this plan rests heavily on the shoulders of community organizations. You are the indispensable link between a statewide strategy and the individuals who need it most. Community organizations are encouraged to adopt and implement this plan for critical reasons. Aligning your programs with the plan's trauma-informed, evidence-based practices is key to securing vital funding. Your localized services are essential for delivering the holistic support and healing-centered care necessary to break cycles of violence. And by adopting the plan, you are leveraging the latest research and data to inform efforts that identify those at risk and build protective factors within your communities. Ultimately, the plan serves as a powerful tool for opportunity, creating a framework that leverages local knowledge and state resources to build safe and healthy communities. In closing, I want to thank Dr. Rachel Garth, our presenter, panelists, Avik Das, Val Free, Dr. Blair Lewis, and Loretta Rice Barnes for joining us today to share their valuable insights. Please enjoy today's program, and Sydney, I'll hand it back to you.
Thank you so much for those inspiring words, Director Adams. We're going to jump into our program we have today. We'll start with a presentation of the Statewide Violence Prevention Plan goals and recommendations with Dr. Rachel Garth, the plan's lead researcher and associate professor with the University of Illinois Urbana-Champaign School of Social Work. Rachel?
Good morning, everybody. I'm here today to talk about the goals and recommendations that collectively we wrote as a group over the last couple of months, really to inform different things that programs, organizations, funders, and communities can do to come collectively together to really move towards preventing violence across Illinois. So collectively, our group wrote 3 overarching violence prevention goals. I'll be going through those goals very briefly today. We'll be digging into different components of these goals and recommendations in a little bit with our panel presentations. Our first goal that was written was to prevent violence and promote health and safety through trauma-informed, healing-centered, evidence-based, and comprehensive primary, secondary, and/or tertiary prevention efforts. The second overarching goal is to advance equity by increasing access to grants and other economic opportunities. And finally, our third goal is to promote collaboration across state, municipal, and community-based agencies, informed by research and data, sharing our best practices and lessons learned, and having ongoing discussions. So within each of the overarching goals, we have a series of recommendations and grouped really to target different groups that these goals can be helpful for. So the first set of goals underneath preventing violence and promoting health and safety are recommendations for programs and services. So any provider who's delivering violence prevention efforts can look to these recommendations for different recommendations related to engaging families in schools, addressing risk and protective factors across families, across communities, which groups to really focus on their efforts, and also addressing local needs using evidence-based practices. We also recognize across these goals and recommendations that there's a lot of jargon, a lot of keywords that are used to really articulate these different recommendations and goals. And one of our other ongoing projects is to build out resources on the website so that programs that want to adopt any of these recommendations have those resources available to them. So we will be building those out in the near future. And also underneath goal number 1 is recommendations specifically to organizations. So this is really thinking about if your organization is delivering violence prevention efforts, what are some recommendations within that? Some of them are around strengthening capacities, looking at different policies and training efforts within your organization, how to really foster culturally responsive, healing-centered environments at the organizational level, looking at screening practices and referral networks, the use of evidence-based practices and evaluation within the organization. And then finally, to really support prevention staff's health and well-being. This is hard work, and really thinking about the ways in which we can support and elevate the work that is going on within your organization, and making sure that your staff is well supported through these efforts is really essential. The second goal is advancing equity by increasing access to grants and other economic opportunities. So thinking about at the organizational level, if you are a funder engaged in this work, thinking about improving access to funding. So this is things like your notice of funding opportunities, the application review process, incentives within that. So again, ways in which you can improve access to funding to really address this second goal. Also, in line with this is really thinking about those small and medium-sized organizations. So how can we provide more outreach, mentoring programs, and opportunities to increase accessibility and support for those smaller groups that maybe are starting out or maybe don't have someone targeted to really write grants or to do budget specific for violence prevention. So how can we provide more of that outreach and access in that? Related improvements to reimbursement and budget processes, continuing to really think about the ways in which we can streamline these budgetary and reporting requirements, and prioritizing pay equity, increasing trainings around budgets and reporting. So to really improve systems and communications, this other recommendations. Also within this is to really think about ways in which we can promote and connect grantee work. So really thinking about the exceptional work that's happening in our communities. How can we really elevate the work that they're doing, to share, to really hear from these examples of programs and efforts so that we can really bolster engagement across these different programs. And then finally, our third goal is all about promoting collaboration, sharing out information, learning from each other, having ongoing discussions, because that's where the magic happens, right? Having these conversations that we can really continue to work together around these topics. So continuing to look at data trends, looking at research, but also hearing from different groups and feedback along the way. We also have an ad hoc violence prevention committee that meets quarterly. These are a great space if you want to hear about violence prevention efforts that are happening across the state, sharing out funding opportunities. We want to have some type of project that we work on as a group, so really thinking about how we stay connected in that space. And similarly, we hope to eventually host a statewide violence prevention event that can really showcase the research, the programs, the evaluations that are happening to, again, learn from each other and to really encourage that communication and collaboration across everyone involved in violence prevention. So again, these 3 goals are really targeting different groups, whether they are working with the programs themselves, the organizations, the funders, and then how do we keep all connected as we collaborate and work effectively together with our common goal of preventing violence and promoting safety and well-being. So with that, I'll pass it back over to Sydney, who will be introducing the panel presentation.
Thank you for that excellent presentation, Rachel. We have a lot of work ahead of us. You've given us a lot to talk about, so allow me to introduce our panelists for today's discussion. Val Freed, founder and chief executive officer of the Neighborhood Network Alliance. Avik Das, executive director, Justice Advisory Council, and a member of the ICJIA Ad Hoc Violence Prevention Committee. Blair Lewis, North Region Manager, Advocate Trauma Recovery Center, Advocate Condell Medical Center, and Loretta Rice Barnes, Executive Director of Metro East Organizing Coalition. So we're going to jump in with some questions. Avik, ICJIA's statewide violence prevention plan emphasizes a public health approach to violence prevention. What are the most significant challenges in shifting from a traditional criminal justice model to this public health framework?
Good morning, Sydney. Thank you. I appreciate that the Cook County Justice Advisory Council, or JAC, can be part of this esteemed conversation. Congratulations to ICJIA, to Dr. Garth, Director Adams, and all on an important plan that we are excited to be able to affirm and stand as a guide for our great work. I'm going to speak of two systemic challenges among many challenges that present key opportunities for innovation, both for our traditional criminal legal and our public health systems. That is to say that I believe ICJIA's statewide violence prevention plan provides a key framework for these systems to work together to center the well-being of people as opposed to reacting to crime as key to addressing violence and making communities safer. The first challenge has to do with the limited tools available to the traditional criminal legal system. These are tools that identify or meet the needs of people and who experience violent crime and come in contact with the police, courts, jails, and prisons. This carceral system is essentially unique in that it alone is authorized to take away a person's liberty, property, and even life for the purposes of enforcing the law, maintaining order, and promoting public safety. So as a tool for violence prevention then, this traditional criminal legal system is a hammer that is often too quick to view the communities it touches, primarily Black and brown people, as a nail to drive down with prosecution and incarceration. So at the risk of pushing this tool analogy a bit too far, how do we expand the criminal legal system's toolbox to address violent crime with the tools of public health, centering well-being and care as a means to address risky or harmful behavior? How do we create more opportunities for criminal legal systems to access trauma-informed, culturally responsive and competent physical and behavioral health services closest to our youth, families, and communities most impacted by violence? This leads me to the second challenge: building the capacity of healthcare providers in community and large healthcare systems to work specifically with justice impacted and involved populations. That is to say that providers may be well-intentioned, but that they are not necessarily ready, willing, or able to work with justice impacted people. Essentially, I've suggested that the challenges facing both the traditional criminal legal and healthcare systems is one of centering the needs of people and not allowing criminal acts to silo people from the very services and care they need to heal and for communities to be safe. Thank you.
Thank you, Avik. Larita, the plan aims to advance equity by increasing access to grants and economic opportunities. What are some of the systemic barriers that have historically prevented smaller, grassroots, and minority-led organizations from securing and managing significant grant funds? And how can funders and government agencies dismantle these barriers?
Thank you, Sydney, and good morning to everyone. I'll start off by highlighting some of the systemic barriers that has directly plagued our Metro East area. Historically, funding does not make it downstate to the East St. Louis metro area. It typically gets caught up and distributed in Chicagoland. And if it does make it downstate, it goes to organizations that have political connections, name recognition, or that has historically received funding. Other systemic barriers is funders' perception of risk. You know, sometimes funders often see smaller organizations, especially those led by people of color, as higher risk or less capable of managing large grants.
complex application and reporting processes, funders requiring elaborate and lengthy proposals or certain type of language, whereas in most cases, these organizations do not have a grant writer, they do not have consultants, data requirement is also a barrier. Funders requiring formal accounting systems or audited financials, being 501c3 are barriers. And then short-term cycles, grants that are project specific, making it hard for sustainability and also long-term planning. Many foundations only issue large grants which require prior experience managing large budgets. And it creates a circular systemic barrier for those who have never been given a chance or haven't received prior funding. And then how can funders and government agencies dismantle these barriers, relax the unrealistic requirements, give smaller grassroots and minority-led groups a chance by investing dollars to build their infrastructure for staff development and for capacity building to hire consultants, grant writers. And for God's sake, unrestricted funds that allow organizations to utilize dollars as needed for program development and expansion, and lastly, initiate models like what ICJIA did, with the I2I cohort that allows organizations to receive capacity building training and financial investment at the same time.
Thank you, Larita. And just to declare, I2I is the Institute to Innovate program you can look into. Val, the plan calls for investing in evidence-based programs that address violence before it occurs, immediately following the occurrence, and in the time that follows to facilitate healing. Describe your organization's work in primary violence prevention, and what key factors make primary violence prevention services successful?
Okay. Well, thank you, Sydney, for this opportunity. I really do appreciate it. We are a grassroots, block by block community engagement organization, and we organize around community development issues. But what we feel is that an organized neighborhood is a safe and prosperous neighborhood. So our primary focus is always, how do we bring community members together? What do they need to flourish? Listening to them. We started a campaign called Hey Neighbor. You probably can see my t-shirt, but we started a campaign called Hey Neighbor because what we found is that our neighborhoods are being described as hoods, that we have programs that are that the word hood is in it, and hood is definitely a negative connotation, but we're expecting good things to happen, and we have to change that. So what we've been doing is creating a movement where community members say hey neighbor to one another. Sometimes we ambush people, we have walks and we ambush people as they're coming in and out of their doors with hey neighbor. But our real goal is, look, we are not the organization that deals with the group that's already at the hospital, already at the jailhouse. Our goal is to deal with the root cause, and the root cause is to create village. The root cause is to make sure people feel safe. Even if their home are not safe, you can talk to your neighbor, you can come to your neighbor. And so this is what we're doing, and we're creating small neighborhoods within the neighborhood, what we call our area councils, in which is a quadrant from a 15 to 40 block radius. There are 12 of them in South Shore. We're not complete with it, but we know that within that 12 to 40 block radius, people know one another. They're not looking to figure out where's my dentist, where's my doctor, who could help me with this. They learned that within that model. So we are looking at, it takes a village to raise a child, not just one parent, but the entire body, the neighborhood, if that answers. So how do we measure impact? We measure impact by, first of all, seeing how many people remember to say, hey, neighbor, but we also measure impact by seeing the change in the areas that we have already organized and how people come together. When we have community meetings, how many people show up. There are a lot of neighborhoods that have real pressing issues, but you do not see the numbers that we get because of the way that we organize.
Great, thank you, Val. It takes a village to prevent violence, block by block, right?
Yes.
Dr. Blair, how can we ensure that violence prevention and intervention programs are not just evidence-based, but are also trauma-informed and culturally responsive to the communities they serve? What does a trauma-informed and healing-centered environment truly look like in practice?
Yeah, good morning, everyone, and thank you so much, Sydney and ICJIA, for having me here. Val, I'm gonna have to take that one. Hi, hey neighbor, or hi
Yeah, it's
neighbor
a
for
movement.
sure.
You can get a t-shirt.
I love that. So one of the things is really involving your stakeholders or your neighbors and making sure that they are involved in the village. And so you want to ensure that there's someone there who has lived experience, primarily because it brings your research and your data to life. It gives it a qualitative element or information as it relates to that. And so another thing is you want to boost the efforts to be inclusive and equitable. And this does that by having a variety of voices that are influential to your organization at the table involved in the conversation. Now, I know some years ago, we had a burst of trauma informed trainings going on. Not to say that they have stopped, but one of the things I always highlight is ongoing training around informed care or practices, perspectives, approaches, and partly because one, two, three, maybe even five trainings won't even do the bunch. What happens is you end up exposing yourself to the concept, but we are creatures of habit. We get right back into the things that we used to do, or we end up training ourselves to see things in ways that are conducive to our lives and not others. And so, ongoing training, it helps you to keep your mindset fresh, and it allows for you to continue to work on those elements around building trust, maintaining safety, empowerment, and encouraging collaboration amongst your team so that they're solution focused. And so, trauma informed training has to continue, it's ongoing because their blinders come right back up and we create new blind spots along the way. That's just part of being human and dynamic. Fourth, I would encourage everyone to really avoid using interventions as this blanket cover. You won't want to take a one intervention out and say it works for everyone. It doesn't, and so we have to remain flexible, adaptable, and really work on focusing on who you are serving, and that requires us to kind of switch up as needed. And so I'm a strong believer in research and information. I love all of that, but it does not cover all areas or all people. And so you really need to incorporate aspects of the culture of the people that you're serving, you're caring for. And that may include traditional elements of their culture, faith, language, and the list goes on. And so the more that you're able to integrate all of those elements, you are going to enhance the services that you're providing. Fifth, I really encourage this healing centered perspective, and it moves away from focusing on the harm that was done that created this wound, but it really helps to eliminate the wound. And so you're taking what hurt that individual, and instead you're strengthening the individual with what will have a long lasting effect by focusing on healing. And a lot of times, trauma, we use words like resilience, it makes you resilient, and that's all great. However, we don't want to stop there. Some communities are really resilient, but some communities don't get an opportunity to dabble in the privilege of healing. And so, although trauma may bring forth resilience, healing brings forth joy. And last but not least, I wish I could put it on a billboard right here, but I can't. Is essentially you want to hold your organization, yourself, your stakeholders, hold everyone accountable in implementing these tactics. And nothing's worse than getting into a group conversation and getting all this strategy together and we have it up on the board, but nobody's actually following through on it. So accountability is the thing that's really going to bring forth results.
Great, thank you so much, Dr. Blair. Avik, collaboration is a cornerstone of this plan. From a practical standpoint, what are the most effective strategies for fostering genuine collaboration among state agencies, municipal governments, and community-based organizations, especially given the historical fragmentation of violence prevention efforts?
Thank you, Sydney. Val, Larita, Dr. Blair, it's great to hear the wisdom you're sharing. And I hope in talking about the collaboration on the government side, that you can see sort of the space for your vision for how we are hey neighbor, how do we support smaller organizations, how do we stay in relationship with each other. So here in Cook County, since 2021, we've collaborated with the state of Illinois, including the Illinois Criminal Justice Information Authority, ICJIA, IDHS, and the city of Chicago. Together, we are the Government Alliance for Safe Communities, or GASC. So this alliance certainly reflects organizing around shared violence prevention principles, such as those outlined in the statewide plan. It exemplifies critical weekly, if not daily, work of government, creating space for partnership with the community most impacted, community-based organizations, and other stakeholders like philanthropy, business, and academia. So the visible work of GASC or GASC includes coordinating funding strategies for violence prevention programs like CVI for the city of Chicago, the suburbs of Cook County, and greater Illinois. In practice, and I hope Larita can see these work streams as valuable, the work streams under the GASC include regularly convening CVI organizations as a community of practice to support networking and regular collective information sharing around progress and challenges in addressing gun violence in Chicagoland. Data collected across the different government grantors and the processes of grant making are all under regular review with an eye towards streamlining and standardizing the experience of data collection and grant administration, not only for the grantors, but primarily for the grantee organizations so they can access these supports. On behalf of the GASC, ICJIA has established a capacity building network to support organizations funded by GASC partners, and this builds on the Institute to Innovate work. And in this way, this strategy recognizes that the critical direct services that organizations provide and the workforce that provides those services need the space and support to manage their organization's infrastructure, their back office, and sustain their work beyond any one grant or overall funding strategies. While the statewide violence prevention plan provides a visible and thoughtful framework, it is important that there is an infrastructure in place to move from implementation to practice. The collaborative strategies of the GASC that I've just briefly touched on provide that infrastructure to move from plan to action.
Great, thank you, Avik. Larita, beyond funding, what are the most impactful ways that funders can use their influence and resources to promote equity and community ownership? How can they shift power dynamics to ensure that communities most impacted by violence have a lead role in designing and implementing programs?
That's a great question. I think, helping to raise awareness of the work that organizations that may not have a strong media presence, that are in the trenches, that's doing the work, that, that kind of, those efforts or support is supporting peer exchanges. I remember back with the White House Civic Project, we had groups from Detroit that went to Oakland, and they were sitting with individuals who had more experience than they had. So they were able to share amongst each other across models that work in other areas. Help develop think tanks that includes access to subject matter experts. The subject matter experts are, an excellent resource for grassroots organizations, smaller organizations to help in the absence of staff that you may not have, invest in those groups that support listening sessions that are happening right in their community, but are backed with funders and other stakeholders to bring, to amplify the work that's happening, and then recommendations to other funders so that the work can be expanded, sustainable. In terms of shifting the power dynamics, ensuring a lead role in designing and implementing programs, shifting power dynamics to ensure lead roles and implementing programs. For example, MEOC, as I mentioned earlier, was part of I2I, or is part of I2I first cohort, and have gained insight and knowledge. We've been able to build out our back office, strengthen our infrastructure. We're positioned to provide training and technical assistance to other groups and programs that may need support. Power dynamics being shifted by supporting the work of being an intermediary, to help identify other local organizations that are on the ground doing the work. Who best know who's doing the work besides those who are on the ground doing the work? So that's super important, in this area. And then supporting, around capacity building, making sure that organizations like ours are invited into conversations. Power dynamics are shifting by developing advisory boards that are specific to the work, that includes those who are closest to the pain, because those who are closest to the pain are closest to the solutions. And so you need those with lived experience at the table in those conversations, not just the doctors or the scientists or, the funders, but those who are closest to the pain and those who have that lived experience. Those are, some ways that the power dynamics can be shifted.
Thank you. Those were excellent ideas. Dr. Blair, the plan highlights the importance of data-driven decision-making. How can we improve data collection and analysis to understand better who is most impacted by violence and to identify the specific risk and protective factors within a community?
Yeah, I'd like to highlight that we put a great emphasis on research, data collection, and the use of that to inform, but not every organization has the systems to support such work and or even the knowledge on how to build those systems. And so this is where I want to again highlight engaging your community and your stakeholders, because Cindy, I think you mentioned it earlier after Dr. Girth went forth, is that there's a lot of work to be done and we are all going to have to band together in order to accomplish it. And so this is where you partner with other organizations in order to utilize the data that they have, the data that you have, and it enhances and informs both of the work that you're doing. And this is what we have to do when we are playing nice in the sandbox. I don't use quotes to be sarcastic, air quotes to be sarcastic, but more so in the sense that we have to be transparent with one another when we are wanting to partner. And a lot of organizations can be very hesitant and reluctant to share data, but through that full transparency and the honest communication and connection with one another is where we really are able to strengthen what you've gathered and what I've gathered, and we are then able to utilize it to the best of our knowledge. And so as you're developing data collection systems, I want to highlight that they have to be ethical and secure. We're collecting very sensitive information, and we want to ensure that as people are sharing with us, that we are giving them the full confidence that we are going to uphold it with great respect. And Larita, you brought up, I think, listening sessions, and I love that. I was going to mention focus groups or something very similar, so that it informs the quantitative data that you're taking. So as you're collecting data, it will help you to zone into focus points or focal points. In other words, it tells you which areas are going to need a little bit more attention and why. And it may even inform you on how to best approach it. And this is how we take data and actually use it to inform the work that we're doing.
Yeah, thank you. That's great. I think it's true. Data shouldn't be seen as punitive if we're not getting the results we hope for. And I think, Dr. Garth, we need to do more listening sessions in the future. Val, the plan places a strong emphasis on capacity building, recognizing that community-based organizations require budget training and a robust infrastructure to deliver effective violence prevention services. What challenges do small organizations experience once they receive grant funding and prepare to run their programs?
Yeah, a lot of them are going to experience the back office operations. And with those funds, there should also be room for day-to-day operations, right? But the back office is high on the man on the plate in terms of what small groups like mine, grassroots organizations, because a lot of times we get into this work for the work, not necessarily the back office. And when that comes up, because we are handling funds that require administrative skills, it require paying attention to details. It definitely acquires an accountant. And even with the accountant, sometimes you need to pay attention and understand what the accountant is doing. And with that being said, it just has to have I feel like they need to have flexibility for newbies, if that makes sense. There should be a learning curve, but grace with that learning curve in the training. So this is the first time I'm hearing about your training with the Cook County, but there are organizations like mine that may not ever hear about those, but they got funds. They get they get awarded funds. What are we going to do to make sure that they stay above bar and they're still able to do the work? I can speak from my own experience. When we first got started receiving funds, most of my work went into administrative. I couldn't get out there and do the work that I were doing, and my base felt it. They were like, "Where's the OVAL?" Well, the OVAL is trying to make sure that the dots are dotted and the T's are crossed, and I have a decent accountant. These are the things that happen, and just telling a story around that, and making sure that our funders understand that piece, because when you're when you're in the process of scaling up, that's where you're going to find it. You're not going to find it at a $50,000 grant. You're not going to find it at a $100,000 grant. You'll find it at the 300,000 and up, because that's when you really, really do need an accountant. And you also have to pay attention to your staffing. For the first time, you're able to hire people. You may not have put it in your budget to go through a staffing firm, but you need a staffing firm to help you dissect or do what I did, hire people from the community, but that may not always be the best solution. So just the HR factor and the accounting factor are very, very, very important parts when it comes to funding and back office, and what a funder should basically give some grace to when you're dealing with grassroots organizations.
Great, thank you. That's great information. So this last question is for each of you, and I'll have you obviously all respond individually. This is a challenging time for many in the violence prevention field. Federal CVI funding has been cut, and the Trump administration is targeting Illinois, Cook County, and the city of Chicago for their approach to immigration, crime reduction, and criminal justice reform. What do you want the violence prevention community and residents to keep in mind during this uncertain and unprecedented time? Val, we're going to start with you.
Okay. Well, again, my answer is going to be an organized neighborhood. I don't care how much money is involved, because I've been organized. I've organized for 11 years with no money, and I've organized for a few years with money. So I can tell you the difference, that an organized neighborhood is a safe neighborhood. It doesn't matter if you have money or not. The people is the engine. So if we have the people, we can organize. We can stay organized, because we're better together than we are. You're over there and I'm over here. So that would be where I would put that. But we do need money. So any funders out there, don't think we don't need money. But at the same time, if in times like this, we just have to stay organized.
Great, thank you. Avik?
Thank you. I'm going to build on Val and also some concepts of Dr. Blair as well. We're a government funder, such as the Justice Advisory Council or the GASC. At specifically this time, we have to remember that we're investing in relationships. It's the relationships that Val is speaking to at exactly a moment where we need to count on our local neighbors to help ensure each other's safety. space where that's being questioned or attacked from outside. And in that way, what I'm building on is Dr. Blair's point of view, which is sitting with me, that we're experiencing a collective trauma that might beget resilience. But I think there's this longer term concept of how do we resource healing to lead to joy.
Yes.
And it's in that space that I think this violence prevention plan provides an umbrella to stay true to our principles locally when they are being contravened or undermined nationally.
Yeah, thank you, Avik. Dr. Blair.
Yeah, I echo a lot of what you just mentioned, Avik. I want to add that just to speak to the heart of the matter of what we do. I believe that we do this work not just because the opportunity is there, but because we see that there is a deep need for it. And it expresses compassion for the people that we serve, the communities that we are a part of. And in order to truly accomplish that, you can't lose the heart of the matter. You cannot lose the reason why you do this, who you do this for, what is the purpose here. And I always tell people when people are coming onto our team or you're getting ready to dabble into trauma work, although it's this buzzword that a lot of people are attracted to, it is not easy work. It is not honey every day. It is not sweet every day. And it comes with many challenges and barriers. And in order to get over that without being blown out by the energy that it exerts, you have to really have some type of personal and professional investment in the work that we do. And so my encouragement is don't lose the reason why you do this. This is getting down to that personal and professional core value of why is it that you decided to jump into this work as a individual? Why is it that this organization decided to invest into this type of work? Because it has value, it has purpose, and it actually is serving and transforming the places that we live in. Again, just want to reiterate, don't lose heart of the reason that you do this work.
Great, thank you, Dr. Blair. Larita.
Thank you. And, you all really laid it out and shared some very important elements of the work. And as you were talking, in addition to what my response was going to be, I was just thinking about in terms of community violence intervention itself. The term is a newer term and it's being built out across the country, the ecosystem, hearing that being built out across the country. And you've had many individuals and organizations historically that has been doing this work for free, doing it from the heart. We call it heart work. It's hard work, but it's hard work. And they've been in the trenches doing this work consistently without money. And so with the former administration, Biden administration, as historic allocations begin to go out to professionalize the field, because the field wasn't, seen as a professional field when you're out mediating and intervening to disrupt violence in your community. But now the funding comes, and then here we are now with the Karen administration seeing cuts and restrictions that are happening after this windfall has come, where people can see money going into their communities. And so the violence prevention field was already suffering before, again, because of lack of resources, right? And the field not being professionalized. But I think one of the things that we must remember right now is that we must remain unified. We must remain unified, being cognizant that we might have to pool resources amongst one another to keep the work moving forward. Understanding that right now it's Chicago that's being invaded, but it can be any of our cities based on how the current administration is moving. It can happen in any of our cities or states at any time, and that we are in a vulnerable place. And so I think that everyone should take notes of what's happening, begin to strategize on what next steps look like in order to save democracy, in order to amplify funding, and realize that we are better together. And your purpose, I believe someone said before, many was doing this work before they ever got funding. So don't grow weary it's like, if you did it before, you do it again. You know, I'm a church girl. And so that, even though the restrictions are happening now, just know that we can stick together and we can make things happen. So that's what I have.
Great. Thank you, Larita, and thank you to all of our panelists for your inspiring and thoughtful remarks and contributions today. I also want to thank Director Adams and Dr. Garth for being with us today. And before we leave, I do want to give a special thank you to our community-based organizations all throughout the state who invest blood, sweat, and tears every day to make our communities a safer and better place for all. This brings us to a close, and I thank all of you for joining us and hope you have a wonderful afternoon.
Thank you.